Good day. I'm going to speak to you about the epidemiology of hypertension. Our main objectives for this lesson is that at the end of the lecture, you should be able to know the importance of the burden of hypertension in Africa. You should be able to explain the causes of poor awareness, treatment, and control of hypertension, and also you should be able to identify the changes in attitude that are needed to improve this situation. So let's start to look at the importance of raised blood pressure. As you can see in this graph, the attributable death due to several risk factors, it is mainly the most important risk factor is raised blood pressure. It is much more important than tobacco consumption or diabetes or physical inactivity. So really, high blood pressure is the most important determinant of morbidity and mortality in the world. But it has never always been like this. This is a very interesting paper that has been published a long time ago in 1929 by a medical doctor called Dr. Donnison, that said that over 2 years at a native hospital in the south of Kavirondo in Kenya, during which period approximately 1,800 patients were admitted, not a single case of raised blood pressure was encountered, although abnormally low blood pressure was not uncommonly encountered. On no occasion was a diagnosis of atherosclerosis or chronic interstitial nephritis has been made. If this situation was in 1929, nowadays the situation is totally different. In this more recent paper published in The Lancet in 2017, the author says that during the past 4 decades, from 1975 to 2015, the highest worldwide blood pressure levels have shifted from high-income countries to low-income countries. And which low-income countries? Those in South Asia and in Sub-Saharan Africa. This is another paper, more recent, that shows what are the trends of the effect of exposure to high systolic blood pressure. And you can see that this gray line here is Europe and Central Asia. It has been decreasing from 1990 to 2019. The same happens in North America, this green line. If we would guess what is the line that is related to Africa, is the brown line that has always increased from 1990 to 2019. And in 2019, the exposure to high systolic blood pressure is the highest in Sub-Saharan Africa than in any other part of the world. But the situation is not only a raised prevalence of hypertension, it is also how do we deal with this raised level of hypertension. In this paper that we have published also a few years ago, and comparing the situation in Sub-Saharan Africa with the situation in Latin America, Europe, and Eastern Mediterranean and Southeast Asia, you can see that the cascade of diagnosing and treating high blood pressure is worse in Sub-Saharan Africa. From 100 hypertensive patients, a little bit more than 60% of them have been measured the blood pressure. Around 35–40% have been diagnosed as being hypertensive. Of those, only less than half are on treatment, and less than 10% are controlled. So we have really a very bad situation in terms of control. So we can now have the first conclusion of what we said till now, saying that high blood pressure was almost non-existent in Sub-Saharan Africa in the beginning of last century. Today, the highest prevalence of hypertension in the world is in Africa, and more. In Africa, we have the lowest prevalence of awareness, treatment, and control, which means that we do not diagnose, we badly treat, and we almost do not control. But I would like to discuss with you why. Why has blood pressure increased first, and then why it is not treated and controlled. Let us start by why has increased. And I will use this paper that has been published a long time ago, 30 years ago. It was a very nice study done by Neil Porter, also in Kenya, to demonstrate the magnitude, the timing, and the cause of changes in blood pressure that occur in migrants from a low blood pressure population on moving to an urban area. This was a controlled longitudinal observational study of migrants as soon after migration as possible, and follow up at 3, 6, 12, 18, and 24 months after migration. A cohort of controls leaving, that they stay in the rural area, who were matched for age, sex, and locality, were also observed at the same time. And what did they find? They find the mean systolic blood pressure of migrants was significantly higher than that of controls throughout the study. So it increased when they moved to the city. The migrants' mean urinary sodium and potassium ratio was higher than that of controls that stayed in the rural areas. And finally, weight and pulse rate were also higher among migrants. So we can conclude that this suggests a marked change in diet of new arrivals in Nairobi, with higher salt intake and calorie intake and a reduced potassium intake. The higher pulse rates in the Nairobi participants also suggest that increased autonomic nervous system activity could contribute to the higher blood pressure levels. And why it is not diagnosed, treated, and controlled? Well, because hypertension is completely asymptomatic. Please take this message because it is extremely important. There are no symptoms on an hypertensive patient. This means that the patient with high blood pressure feels nothing and has no sign to go to the hospital. And as you know, for example, men in sub-Saharan Africa, they just go to the hospital when they feel bad. So that's why, for example, the awareness in men, it's much worse than the awareness in women. But it also means that we have to measure the blood pressure to all patients that come to our health unit, independently of the reason why they come. On the other hand, hypertension is a chronic disease. That means that patients have to take the medication every day of their life, even without feeling sick. And this is extremely important to convince them of that. The only way that we will be able to increase the adherence to patients to the medication is to have time to talk to them and to explain the need to take the medication every time and not to stop it. So in conclusion, we would say that hypertension is the most important determinant of health in the world. Hypertension is extremely common in Africa. 1 in each 3 adults has high blood pressure at least. Hypertension is completely asymptomatic. That means that we need to measure the blood pressure to all patients independently of the cause of the consultation. And finally, we need to create a good relationship with the patients, having time to talk to them and to explain the need to never stop the medication. And thank you very much.